Good day, everyone. My name is Asal Vijay Singha, and today I will be presenting our research titled Perceptions and Knowledge About Prostate Cancer and Attitudes Towards Cancer Screening Among Males in the General Population. So, prostate cancer is an adenocarcinoma of the prostate gland, which can spread locally and systemically via blood. Those who are at high risk are men over the age of 45, those with a family history, and with a westernized diet. Common symptoms are predominantly voiding type in lower urinary tract symptoms, and the screening tests available in Sri Lanka are prostate-specific antigen test and digital rectal examination. So why we decided on this topic was because prostate cancer has a high mortality in Sri Lanka, and the level of knowledge predicts the likelihood of early detection of symptoms, which carries a good prognosis. And the knowledge and attitudes towards cancer screening are important factors in deciding if men would present for screening. Our general objective in this study was to describe the perceptions and knowledge about prostate cancer and attitudes towards prostate cancer screening and associated factors among males aged more than 45 years in the general population. We explored the perception and knowledge about prostate cancer, knowledge, attitudes, and practices regarding cancer screening, and the factors associated with them. So, in our methodology, we studied all males above the age of 45 in selected schools, offices, and other settings, mainly from the Colombo, Gampaha, Kandy, and Kurunegala districts. We excluded those who had ever been diagnosed with prostate cancer, healthcare workers, and those who are unable to respond to questionnaires. The calculated sample size was 403. However, unfortunately, due to the restrictions placed by the COVID-19 pandemic, the obtained sample size was 90. Um, we collected our data using an online self-administered questionnaire as a Google form. Descriptive analysis was performed using frequencies, proportions, and means, and inferential analysis was performed using the chi-square test. We calculated the mean knowledge score using the responses given to us and used it as a cutoff for good and poor knowledge of signs and symptoms and risk factors regarding prostate cancer and knowledge about cancer screening. Moving on to our results, most respondents had the mean age of respondents was 54 years. Most were from Colombo and Gampaha districts and were married and were predominantly singular Buddhists. Most had completed their A levels and had an income greater than 25,000 rupees. They were mostly employed and roughly half had medical insurance. So regarding the perceptions regarding prostate cancer, 79% have heard of prostate cancer, whereas 90% were unaware that they were at high risk. And the common fears were the cost of treatment, death, sexual problems, and social isolation. So 53% of the respondents had good knowledge about signs and symptoms of prostate cancer and about the risk factors, but only 42% had knowledge about screening tests, as we can see. So marital status and employment were the significant factors associated with overall knowledge on prostate cancer and screening. We saw that those who were never married and were unemployed had better knowledge than their counterparts. Regarding the attitudes and practices regarding prostate cancer screening, 91% have not been screened for prostate cancer, and 62% of those who were screened were referred by a healthcare worker. 84% responded unfavorably towards future screening, and those who did respond favorably preferred prostate-specific antigen testing. So, education, medical insurance, and the perception of future likelihood of prostate cancer were the significant factors associated with attitudes towards prostate cancer screening, where we saw that those who were more educated and thought themselves likely to get prostate cancer in the future had favorable attitudes. However, surprisingly, those with medical insurance had an unfavorable attitude. The most common sources of information were from friends and relatives, the internet, and newspapers. However, we found that the healthcare input was quite low, including the family doctor. So our findings showed that most people were unaware of the risk of prostate cancer, which is similar to a study done by Steele et al. In New York. So this reflects the general lack of awareness among those at high risk. And in our study, only 8 of the 90 participants had ever been screened for prostate cancer. This is similar to a study done by Yebo et al. Among male teachers in Ghana. So we can see that those who are at risk are not being screened. In our study, most of those who had been screened were referred by a healthcare worker. similar to the findings of Steele et al., who also reported the similar percentage of participants being referred by physicians. So this reflects the importance of doctors in ensuring compliance with screening tests. And our study showed a significant association between lower education levels and unfavorable attitudes towards screening. This is in concordance with studies of Yebo et al. And Winterick et al. So we see that those with less education seem to be unlikely to present for screening. So in conclusion, most have heard of prostate cancer, but most are unaware that they are at high risk of getting it. Knowledge on screening was low. Most had unfavorable attitudes towards screening. Most of those who have been screened were referred by healthcare workers, and only a minority had been informed by screening by healthcare workers. So, from those conclusions, we can recommend that future awareness programs should focus on educating the public on signs and symptoms and risk factors regarding prostate cancer and the screening tests available. And since those who had medical insurance and were of a lower education level were more likely to default on prostate cancer screening, they should be followed up if they are at high risk. And most importantly, healthcare workers and the family doctors should inform males above the age of 45 of their increased risk of prostate cancer and promote screening and offer screening services to them. These are our references. Thank you very much.